Hi everyone, this is Dr. Stefan. In this video I'd like to answer a question related to chest pain. So many patients do ask me whether chest pain can be caused by the lungs themselves. And actually that's quite rare because the lungs themselves do not have nerve endings that cause pain. However, there are many other organs within the chest that can cause pain. So first of all, when you suffer with chest pain, when someone suffers with chest pain, it's important to think about the heart. Someone who has angina, so for example, heart-related pain that occurs predictably sometimes when we do some exercise, when we do lift something heavy, especially in people who are maybe the right age for that as well. So that could be potentially over the age of 40 or 50, especially if they know to suffer with cardiovascular disease. So heart pain is the main thing. And then we have to think about the pleura. So the pleura is basically the lining that surrounds the lungs and allows us to expand the lungs, because the lungs themselves, they're not in contact with the chest wall. So within the chest, around the lungs, we have a little thin lining. And then there's another thin lining on the inside of the chest wall. And basically in between these two little membranes, let's call them, there is a little bit of fluid at all times, a very, very small amount of fluid that makes them stick together, like a plastic bag that is a bit wet and you can't really unstick the two membranes. So that's basically the pleura. Now, when the pleura becomes inflamed, or when we have a little bit of air that gets in between the little two membranes, so that would be called the pneumothorax, or when there is a lot of fluid that accumulates between the membranes, so we would call that a pleural effusion, that can sometimes also cause pain. So that's one of the causes of chest pain that's not really lung related itself. It can be related to the lungs, of course, if there is a condition that extends to the pleural space. So sometimes it can happen with chest infections. It can happen also with more serious conditions. The other thing to consider, within the chest, we've got the esophagus. So the esophagus is the pipe basically that takes the food down to our stomach. Now, obviously, acid reflux can cause heartburn. We know that. So that can be a cause of chest pain sometimes, just the acid reflux from the stomach. But also the esophagus can sometimes spasm, and that can also cause chest pain. So the esophagus is another potential cause for chest pain, non-lung related. And the final thing I'd like to say is don't forget about the spine. So the spine itself can sometimes be a common cause of chest pain. And I've had many patients, especially younger patients, who have come to clinic complaining of chest pain around the back area here. So basically they were complaining of this chest pain, but basically they were sitting at their desks all day in this position, typing away, and this position is really bad for the back. It can sometimes feel like a burn in the central part of your back here. It's because of the joints in the spine that become overloaded by holding the weight of your body when you're sitting down all day. So always remember to take breaks, to stretch your back. That can sometimes help a lot with chest pain. So I hope you found this video helpful to think about potential causes for chest pain. But if you do suffer with chest pain, especially if it's severe, sharp, strong, crushing, severe pain, you must see a doctor in those circumstances. And do start with your family physicians for all other pains that you've had for a long time that you can't really get a grip on, because there's no point in living with that chest pain, and it's important to figure out what's going on. So I hope you found this helpful, and I'll see you in future videos. All the best and good health.